So there's been a little bit of an interest of alternatives to implants, and and that's not brand new. That's gone on for a while. And some of these are people that have even previously had implants. I think we've got a photo of a lady who previously had implants, had her implants removed, and had a lift. And the scarring's not great on her. She was new to us at the time when we saw her in that photo. So we worked on her scars over time. As you can see in that photo, there's a great improvement to her scarring. And this is after a couple rounds of fat grafting as well. So there's only so much volume that you can add, but in the right patient who's willing to undergo a couple operations, we can really get a lot of volume add, maybe even the equivalent of what we might get from a reasonable size implant. A lot of people who want implants don't have a lot of breast tissue to add to. So there's kind of a math game there in terms of what we can add. So if somebody's got a 100 cc breast, but they really want a 300 or 400 cc gain, we're not going to get that with just fat grafting and a single operation. With that 100 cc breast, we can add maybe 70, maybe even 100 cc's at best. But of that, we're only going to get somewhere 50 to 70 cc's that survive. And so then we've got 150 cc breasts. And so the next go around, we can add a little more and so on. But all of a sudden then to get a 300 or 400 cc add, you've got you're 3 or 4 operations in. And so no one's really not many people are gonna sign up for multiple operations in that regard. So that's not really the ideal candidate. But somebody who already has a 300 cc breast and they're just trying to gain 200 cc's, well, that might be doable in one sitting. So then all of a sudden you've got in the 2 operations, you get to kind of where someone's goal might be with an implant. And it'll look more natural than an implant will. And the biggest benefits of it is that it ages with somebody over time and doesn't require maintenance like an implant might.